Hello and welcome to Women's Health. Women's Health is hosted by the Mayor's Commission on Women, which is an advisory committee to the mayor. But our program is funded today by the Women's Foundation of Lincoln and Lancaster County. For more information about the Women's Foundation, please visit our website at lincolnwomen.org. Today our topic is contraception, and we're here talking today with Dr. Katie Fossen, who is an obstetrician and gynecologist here in Lincoln. So welcome, Katie.
Hi, Kathie.
And thank you for joining us.
Yeah, nice to see you again.
Contraception is such an important part of a woman's life, and since 99% of women in their lifetime will need or use or want contraception, we really felt that this was a good and timely topic for us to cover today.
Sure.
Let's start out by telling us about the various methods of contraception and what you think are like the best and most common methods being used today.
Sure. So some that women are going to be very familiar with, obviously birth control pills. That's something that's been around for years and years and is kind of a tried and true method. We've got lots of different pills now for lots of different indications that work variously well for different women. There's also the patch that some women have familiarity with, which just sticks to the skin and gives kind of the same contraceptive benefit. The vaginal ring is kind of a newer option that some women aren't quite as familiar with, but it's kind of something you don't have to think about on a daily basis like a pill. You kind of think about it almost on a monthly basis, but it's kind of a flexible rubber ring that just sits at the top of the vagina and then gets removed after 3 weeks and you have a period. So that's something that's been nice. There's also Depo-Provera, which is an injectable medication that's given every 3rd month, which is nice for women that, don't even want to have to worry about something on a monthly basis. So that's nice too. Obviously, there's the permanent forms of sterilization, so males having vasectomies, women having their tubes tied, and there's some new technology called the Esure system that's really exciting that can be done in an obstetrician gynecologist's office, where some small metal coils are actually placed in the tubes. Doesn't require general anesthesia, which is really nice. As far as kind of younger women and women that just really want what's called a long-acting reversible form of contraception, or a LARC is kind of a word that we have now. And some really good options are the Mirena and the Skyla IUD, which basically are just little small flexible kind of T-shaped devices that go right into the uterus. The Mirena is good for 5 years. The Skyla is good for 3. There's also now the Nexplanon, which is a little subdermal implant that actually goes underneath the skin of the arm, good for 3 years as well. So there's lots of new exciting options out there.
Wow, that is a lot of variety.
Exactly.
That's interesting.
Right.
So given all these different choices, what are the things that make the decision for a person? Like, for example, if a woman comes in and says, okay, what are the various kinds of, how does she decide? What are some of the deciding factors?
Sure. The first place I go with my patients, just because a pill is typically the easiest option, say, okay, are you okay with taking a pill every day? Some women are like, that's really not me. I'm not very good at that, and I'm worried about the effectiveness of that if I miss pills. So then I'll usually jump to kind of the longer acting forms in that particular case. If you don't want to have to think about your birth control method every day, like we say, the IUD is a great option. The Nexplanon is a great option. Also, the other factor is how much do you want to space your family? Are you at a spot where maybe you've had a baby, you're married, you don't want to have another baby for a few years, you kind of want to space those kiddos out? Your long-acting reversible contraceptives are going to be a really nice option because even though, like we say, the Mirena is good for 5 years, Nexplanon and Skyla are good for 3, they can be removed at any time that the patient would want to. So say you got a Mirena and you said after 2 years, I want to have another baby. I didn't know, it can be pulled at any time. It's also nice for women that, they're working on their education or they're establishing their job and it's just not a good time for them to have kiddos. Those long-acting reversible contraceptives are going to be a great option for them as well.
Okay, so life circumstances is one thing. What about the cost? Does that have something to do with it?
Right. So certainly cost is a big factor for all kinds of patients. It's kind of one of the things that we have to think about at the crux of kind of everything that we do and what we recommend to patients, because if it's not financially feasible, it's not something that they're going to be able to do do. So those are also things to think about. Certainly health issues also is an important factor. So some women, for example, they have a history of a blood clot, or they have some sort of a disorder where they're prone to blood clots or high blood pressure, things like that. Then we know that an estrogen-containing contraceptive wouldn't be a good option for them. So then we go to either a progesterone-only method or a non-hormonal method like the Paragard IUD, which doesn't have any hormones at all. So health factors can also be another issue too.
Sure, sure. Well, right now when we're talking about the Affordable Care Act, can you talk a little bit about the effect that the Affordable Care Act has had on birth control? We hear a lot about that in the news.
Exactly.
But what exactly are we talking about when it comes, or when it's related to contraception?
Right, right. So the Affordable Care Act did a lot of things in healthcare. It's kind of very far-reaching, but one of the things that it did that's really great is it kind of opened the door for contraceptive coverage for women. So the thought with the Affordable Care Act is that women should have just that, affordable access to essentially contraceptive options, be they birth control pills or long-acting reversible forms of contraception, sterilization procedures, those sorts of things. So the thought was there that basically birth control should be covered for insured women, and hoping to increase that insurance coverage then would also help to, improve that access to contraception that women didn't used to have, because contraceptions, can be quite expensive. So the Affordable Care Act was kind of meant in that particular vein to increase the access for women to contraception, especially the long-acting reversible contraceptives. We're seeing a lot of increased coverage for those particular devices that can be fairly costly. It is still important for women, though, to check with their insurance companies and just make sure, because although the Affordable Care Act is being implemented, in the majority of cases it has gone into effect, there are certain things that still are not covered. For example, if a patient has been on a brand name contraceptive for an extended period of time, it may be now that her insurance will no longer cover that particular brand name, but that they prefer to cover generics. So even though that has increased the kind of the accessibility, which is really wonderful, it's still important for women to check their coverage to make sure.
Exactly, exactly.
But it's done a lot of great things for especially younger women to really increase that access.
Right. And when we're talking about the expense of contraception, which ones of the kinds of contraceptions then are the most expensive compared to what's the least expensive?
Sure. So you kind of have to think about how much benefit am I going to get out of this particular contraceptive. So, for example, a Mirena IUD, you may be looking at about $1,000 upfront cost, with the cost of the device itself and then the cost of it being inserted by a healthcare professional. But at the same time, then you're saying, okay, that's 5 years of birth control. Same sort of issue with the Paragard IUD. You've got the cost of the device itself, but then and the cost of the insertion, but then you've got 10 years of birth control.
And so control, is insurance starting to cover those kinds of things, is what you're saying? Okay.
So there's a lot of increased access. Is one of the big things that we're seeing with the Affordable Care Act. Those long-acting reversible contraceptives are becoming increasingly covered, which is really nice for women.
It is. That's amazing. That's such an important thing.
Right.
And I think that when we talk about the Affordable Care Act, we're talking about things that are important to all women.
Oh, certainly.
And contraception can be an important thing for a very long period of time in a woman's life.
Right.
And so it is really a basic health care need.
Oh, absolutely.
And not certainly something that can be taken lightly. I mean, it is a very integral part of a woman's life for a very, very long time.
Sure. And then as far as cost goes, I mean, you're going all the way down to, a birth control pill that may be $4 a month, depending on your insurance coverage, or may be completely covered now with the Affordable Care Act and kind of those different regulations that were placed on insurance companies for coverage. So it's been great.
Great.
And birth control pills are probably your cheapest option.
Yeah. And it's interesting how many different kinds there are now, how many different methods there are, and finally research is getting up to where it should be as far as giving women lots of different options, which for a very long time that wasn't really the case.
Exactly.
And now it sounds like with all the different kinds of considerations in your life, both where you are in your life and also the cost, there's a lot of different options out there, maybe some that some people don't know about, so it'd be really wise to be educated about it.
Absolutely.
At the end of our program today, we're going to give some websites that would be helpful for women to look at and give them some more information. So whereas we may not be able to cover everything today, hopefully they can do some looking and finding, reliable websites that they can look at. That would be really great.
Right.
Okay, so let's talk about what benefits birth control can have and contraception can have other than preventing pregnancy.
Sure.
Because we hear about contraception in the sense of preventing pregnancy, but what are the other health care or the health benefits of contraception?
Sure. There are quite a few, actually. So some women choose to use actually a birth control pill or a contraceptive to make their periods lighter, more predictable, more manageable, essentially giving that exogenous hormone to the body causes changes in the way that we respond to and produce estrogen in the body. So it usually will decrease the amount of tissue that's built up on the inside of the uterus that then will come out as a period. So periods are lighter, they're a little bit more predictable because when you're hitting those inactive pills on that pill pack, that's certainly a big option for women. Also, mood lability can be a big problem for some women, if they suffer from premenstrual dysphoric disorder or essentially what's been commonly known as PMS. Those mood kind of fluctuations that come naturally with our cycle can be really affected by a birth control method as well, and kind of even out, those changes that we'll see. Some women have a lot of difficulty, relating to their spouse or their kids or the people that they work with because of the big hormone fluctuations that they suffer, or migraine headaches potentially for some women too. So those can be things that are really helped by birth control. Also, acne is one of the benefits that women get. Clearer skin, being on a birth control pill, is something that we'll commonly see. So that's a really nice option as well. And sometimes, it's a life-saving intervention. There are women that, being pregnant is not safe for them, or because of a health care issue that they have, or they're on a medication that they need to prevent pregnancy because it's a teratogenic medication or would be dangerous for a developing baby. So those are some important indications for birth control as well.
Okay, so there are lots of health benefits besides just pregnancy.
And kind of at its crux, birth control, for example, oral contraceptives, they're going to decrease ovulation, which is the process of producing an egg that can then unite with sperm. Decreasing ovulation is also going to decrease the risk of ovarian cancer, uterine cancer, and colon cancer. So those are things that we've seen as well.
Great. Lots of long-term things to consider. Right. And I think that then speaks to what we were just talking about, that contraception is a very integral part of women's health.
Oh, yeah.
And such an important thing to know about and to be educated about, and certainly to know what the choices are and how to navigate the system.
Sure.
What are some of the myths about birth control?
Sure.
Contraception?
I think some myths that it's a common question for my patient. I've been on my birth control pill for 20 years. Is that safe for me? And if you've tolerated it that well, you don't have any issues with high blood pressure or blood clots or, things that make it not safe for you to be on estrogen, and you've done really well for 20 years, you're probably going to do just fine if you continue it for another 10 years. So women worry about also their fertility going off of a pill. Generally, any of the forms of contraception should be immediately reversible as long as they were in a reversible form of contraception to begin with.
Meaning that anything that would be different than surgery, for example.
Right, exactly.
Right. So if it was any of the other methods we've talked about other than surgical intervention.
Exactly.
Okay.
So Depo-Provera, which is the injectable medication, however, can affect your fertility as well as your menstrual cycles for about 18 months after the last injection.
Okay.
So that is one thing to know about. But I think that's a common myth, is that women think, well, if I use birth control for a long time, I'll become sterile, or I won't be able to have a baby, or my fertility will be affected. And generally that's not the case.
That's not the case.
So, yeah. Another thing that we run into a lot is, I think there's a lot of scary things on the internet about IUDs. Women put, you kind of have women posting the bad stories, not always the good stories, So you worry about things like uterine perforation, the IUD migrating into the abdominal cavity where it's not supposed to be. And it's true, that does happen, but it's extremely, extremely rare. And that's something that women will come in and they'll say to me, I'm scared of IUDs. I've heard only bad things. I've of only bad experiences. And if you're having it inserted by a very kind of seasoned and experienced healthcare professional, it should be very safe. So that's another thing that I commonly run into.
That's interesting, because I think that we always have this kind of double-edged sword with the internet, don't we?
Oh, absolutely.
We were just talking
great,
about
but not great.
Yeah, exactly. We were just saying,
Yes.
Look at reliable websites. That's the key right there.
Exactly.
And that sometimes the internet can work against us when it does that.
Right.
When it pulls out two or three little isolated cases gets all blown up, everybody reads about it, and they think that's the truth, and
Exactly.
that might not
Exactly.
be the truth. And I
Right.
think bottom line, otherwise, obviously, we try to get as much information in reliable websites, but the bottom line is to talk to your healthcare professional.
Absolutely.
Don't
Talk to your doctor.
don't depend on the word of mouth or
Well, and even your friends, if they've had a bad experience, that's certainly not good, and we're not happy that they had a bad experience. But that doesn't mean that you'll have a bad experience.
that you will have the
So
same thing.
That's
right?
another thing to think about as well.
So getting to your healthcare professional and getting some reliable
Exactly.
advice about you as an individual is the most important thing.
Right,
That's
right.
really true. Let's talk a little bit about condoms. Where do condoms fit in the whole spectrum here?
Sure. Condoms are really huge. And I mean, they're very pervasive in our country, and hopefully there's a lot of knowledge out there about condoms, but I think there are a lot of things that people don't know as well. Condoms with perfect use, so the effectiveness of condoms in preventing pregnancy in a year, so perfect use, fabulous use, about 2 women out of 100 are going to get pregnant just using condoms, not using another form of birth control. If it's not being used well, that number jumps up to 18 out of 100 if they're just using a condom and no other form of birth control. But the actual benefit that condoms have that no other contraceptive has really is the prevention of sexually transmitted infections.
Right.
So
right.
for young women, even if they are even if they have a neck splint in their arm, even if they have an IUD in their uterus, they still need to be using condoms to protect their future reproductive health.
That's a very good point.
If they're not in a monogamous relationship, it's so important for women and for men, to protect themselves from sexually transmitted infections and certainly unwanted pregnancy. But there are a lot of things, I think, as far as condoms about actual successful use that sometimes people don't think about. For example, some people will buy a big box of condoms, sit them on their shelf, and they do expire. So that is one thing to think about as far as, how can I use them effectively? Making sure that any time that the penis is erect before it reaches the female organs in any way, so we're talking the outside of the vagina, the vulva, or certainly is in the vagina, the condom needs to be placed because there is pre-ejaculate or fluid that can come from the man essentially prior to an actual orgasm, when a lot of ejaculate fluid comes out that can still cause a sexually transmitted infection or can cause a pregnancy. So those are things that I think people sometimes don't realize. They think as long as the condom is on when the man has an orgasm that they're fully protected, and that's not always the case.
That's not the case.
Also, the penis should be taken from the vagina before the erection is lost, in order to keep the semen from escaping outside of the sides of the condom as well. Maybe something that people don't realize. So making sure that it's on before things start to get too exciting, on an erect penis any time before it comes near the vagina is going to be really important. And then making sure that it's taken off, and removed from the vagina prior to basically losing that erection is going to be important to protect the female and the male from pregnancy and STDs as well. There's also the female condom, which is kind of a flexible sheath that can actually be placed into the vagina up to 8 hours before intercourse. It's not as protective against STDs as a male condom is. Unfortunately, females, just the way that we're built, the way that our reproductive system is, the nature of the vagina, we're about 10 to 20 times more likely than a man to pick up a sexually transmitted infection from one episode of intercourse. So for women, it's especially important that condoms are used.
Right? Exactly.
Right.
Well, that's a good point to make about condoms being used in tandem with something else, so
Right.
that you're not thinking the condom is going to be the one and only thing, but rather
Right.
in conjunction with something else, it appears to be the most effective.
Right.
Both in preventing pregnancy, but then also in preventing sexually transmitted infections.
Exactly.
And we have talked on this program about the fact that sadly in Nebraska our numbers are pretty high for sexually transmitted infections. And
Right.
something that's really an important thing to consider then is what ways in which we can prevent those. And,
Right.
and
Right.
obviously condoms and the appropriate use of one is a very important part of that.
Exactly.
So where do men fit into the equation sort of here about reproductive health?
Sure.
obviously we know the man and the condom, but what other roles do men play in that?
Right. So obviously, certainly in a married situation, it needs to be an active conversation between, the husband and the wife. For example, once they're done having babies, is it time for a husband to visit a urology office and get a vasectomy, which is going to be a permanent form of contraception, obviously. Or is a woman going to have her tubes tied, or is that even going to be the case? Something to think about there is that the long-acting reversible contraceptives like the IUD and the Nexplanon are equally effective to having your tubes tied or to have a vasectomy as far as preventing pregnancy. So those are great options. But I think it's just really important for men to be actively engaged in that conversation. And sometimes, men out there, they can be victims of sexually transmitted infections as well.
Exactly.
So they need to be actively involved in that situation and making sure that they're protected.
And don't you think that now when we're looking at, and there's a lot of talk about older women and older men who are engaging in sexual relationships, that the condom and that protection against the sexually transmitted infections is super important. Exactly. It may not be so much for birth control method, but definitely something to consider when we're talking about the sexually transmitted infection. So it's not just the young, but also the older.
Exactly. And it's that particular population that it is a little bit alarming, because we may have women that they're widows or men that are widowers and they've lost or they've become divorced and they want to be sexually active again. Intimate companionship is a great thing for humans, so that's wonderful. But I think older individuals, they tend to think, well, I don't need a condom because nobody's going to become pregnant if they're menopausal, for that matter. But sexually transmitted infections are still something that's really important to think about. Also, older individuals, they may not get tested, so they may not know that they have a sexually transmitted infection. So it's very important, I think, in the older population as well, if you're going to have a new partner, to be very frank with one another. Say, hey, has this ever been in your history? Do you have any history of any sexually transmitted infections that I should know about? The American Congress of Obstetrics and Gynecology recommends testing any woman between the age of 19 and 64 that is sexually active, for example, with different partners for sexually transmitted infections yearly. So I think that's something that maybe the older population, they don't realize is still something that's important, because in our mind, we think of condoms, we think of birth control as just that, birth control, not needing to protect from the other things. So it's important, I think, that women are honest with their healthcare providers, and that sometimes also that the healthcare providers remember to ask those questions, because, the older population may not bring those things up. So I always try to say, for my women that I know that are, for example, newly divorced or newly in a sexual relationship, say, any need for sexual transmitted disease testing, because I always add that in there so they don't have to try to bring it up if they're uncomfortable.
Right.
So
yes,
it's something that's important to think about.
Well, let's go to the other end of the age spectrum then and talk about the teenagers.
Yes.
And, the whole discussion of contraception and birth control with teenagers. What do you recommend? What do you think is an age appropriate time? Right.
So that discussion can be something that's really difficult for parents. I think as parents, we don't always like to think of our children as becoming sexually active or even having that knowledge. But the thing that's interesting in our country, by age 19, about 7 out of 10 teenage individuals have been sexually active in some way. So it's just really important, I think, that parents know kind of what's going on with their children, that they're actively educated, with regard to sexually transmitted infections, intercourse, and sex. But not only those things, but also the reproductive health cycle. What does it mean that I have a period? What's going on with, this stuff? Also, what's a healthy relationship? As women and men obviously have a little bit more knowledge of that, but teenage adolescents may not know, what's safe, as far as emotional, physical, sexual abuse, those sorts of things. So talking with those things is very important. At the same time, a very difficult conversation to start. So Planned Parenthood, their website actually has some good tools on their website, as far as it says tools for parents. So just clicking on that link will get them some good kind of conversation starters. As far as age appropriate, the American Congress of Obstetrics and Gynecology recommends bringing a female to a gynecologist at about age 16. Not for a pelvic exam, not for anything really involving those sorts of things, even if she's not sexually active, but just for a discussion, regarding healthcare and regarding, whatever questions that she might want answered regarding intercourse or sexually transmitted infections and those sorts of things. If, for example, a woman's going to be going off to college, I think that's another good time for, maybe a mom to come in for a visit with her daughter, for example, if they have a close relationship, but this is just kind of a dialogue that mom isn't necessarily super comfortable opening up. Come in and see your OB-GYN, and we can start that conversation for you, and kind of address any questions that your daughter might have. But then that also opens the door for you to kind of be able to reference that conversation in the future and say, so after this discussion that we had. So I think that there's a lot of different ways to kind of approach it, but I think a woman's OB-GYN is a powerful tool too.
Oh yeah, definitely the healthcare provider.
Right.
Well, Dr. Fossen, thank you so much for joining us today. These have been very insightful answers, and we really appreciate the information.
Absolutely.
We encourage you to access our website, which is lincolnwomen.org, to watch this health program as well as lots of others. And certainly you can always watch our programs here on Channel 10 Health. Our program today was funded by the Women's Foundation of Lincoln and Lancaster County. We really thank our generous donors for helping us to continue this mission of educating women and their families in our community. Again, lincolnwomen.org, and I want to thank Dr. Fossen for being with us today. Today we've been talking about contraception.